Hello, and welcome to the Health Bridge podcast. I'm your host, Holly B. Today, we are talking with Patricia Schneider. She has been a nurse for 25 years and has experience working in medical surgical care and psychiatric mental health. She has a doctorate in nursing and is a board certified psychiatric mental health nurse practitioner. But after working with numerous treatment resistant patients that were just stuck, who have been relying on multiple medications for years, Patricia became a certified functional bloodwork specialist to help patients beyond just Western medicine. The reason I really wanted to have Patricia on my podcast is because blood work is such an interesting aspect of figuring out your autoimmune conditions and what is really going on in your body. So many times people go to the doctor, they do their blood work comes back quote unquote normal, and they're left without any answers. Well, a functional blood work specialist understands the subtle nuances of your lab work and can sort of read between the lines and understand where your optimal ranges are versus what is considered normal. And they can help you dive in a little bit deeper to find more answers in what might be underlying your symptoms. So I'm just going to zip it right there. Definitely listen to this one if you are in this strange autoimmune space. So I'm sure some of the things we talk about will be relatable, but you are definitely also going to learn some really good information to carry with you to your next doctor's appointment and just in how you look at your health and your blood work and your treatment patterns or your treatment protocols and how you maybe move through this space a little bit differently now that you have a little bit more knowledge around it. So let's go ahead and dive right in to this great conversation with Patricia Schneider. Patricia, I am so pleased to have a discussion with you here. You're doing some really important work as not only as a psychiatric mental health nurse practitioner, but also in incorporating the holistic side of things through your knowledge of functional blood work and being a specialist in that arena as well. I'm curious if you could share with us how you started. I assume you started as a nurse and how you have come across that holistic divide and combined the two.
Yeah, so thank you for having me. It's great to be here. So, yes, I have been a practicing nurse for a long time, about 25 years, working with really a range of different types of patients and different health conditions. So, I worked with adults in a medical, surgical, post surgical. I did dialysis. I did all of that. And then I had noticed even back then that although I was working in a hospital and taking care of patients in an acute setting, I found that these patients also had chronic conditions and they had chronic symptoms that weren't really being managed very effectively. So I really, always thought, geez, we're great at Western medicine and acute medicine is wonderful for medications and surgery and all kinds of things, but we really don't provide enough opportunities to improve when patients have chronic conditions. So after the traditional medicine, we've tried everything and nothing really seems to help. We drop the ball at that point and we don't really offer anything beyond that. So I found that this was happening to not only patients, but just other women and family members. And just over time, many people are experiencing chronic health conditions and have these symptoms, but then they have their appointments with their physicians. They may have blood work, they have an exam, and then everything comes back as normal. And people will say, well, gosh, it must just be me because everything came back normal. So maybe it's just me. And that's how it is. So it really started me thinking towards, we really need, what else can I do? And I got interested in reading blood work a little bit differently. I was always interested in functional and alternative approaches, especially nutrition. I always was very, I guess, disappointed that we really were never taught nutrition as medicine. It was just like an afterthought. And we really have so much focus on managing symptoms. So I realized that I could learn to read blood work a completely different way than I was taught as a nurse. And the functional analysis of the blood work, we look at much, much smaller lab ranges because we're looking for optimal levels and we want to introduce just opportunities for improving to make sure that we're optimized. So just because we're within normal limits as far as lab work goes, it doesn't mean that it's optimal. So it really has opened up really my eyes. And really, when I delve into the blood work, there are things that are hidden in the blood work that can be causing these vague health symptoms that don't really get addressed until they get to a point where it gets flagged on a normal blood work, or the symptoms are really becoming significant that it's turning into something more long term or chronic. So, yeah, so that's how I ended up here. And I think it's wonderful because it's so much more proactive, taking the steps and everything that we can do ahead of time rather than trying to fix something after it's already happened.
I love that you mentioned the normal ranges versus the optimal ranges with blood work because a standard general practitioner will look at your blood work and say, well, as long as you're within the green instead of out in the red somewhere, you're good. So most people aren't educated in that there is an optimal range within the green, right? So we can use this blood work as preventative. We can start to see that there could be potential issues that can build on each other over time if we don't get things into optimal ranges, right?
Correct. And the ranges are so wide sometimes. So you're right. Unless it's flagged outside of the normal range, it doesn't really get addressed or given much thought. It's just it's just there. But yeah, the ranges can be very wide. So it is ideal to just really narrow down and where are we going to be functioning and feeling our best. And that's where we try to target.
So you had a really great meme on your Facebook, and it was the guy from Dos Equis, and he says, "I don't always feel like crap, but when I do, my labs are normal." And I thought that would be a really great point to dive in to this whole fuzzy area of lab work because I work with women with lupus and other women on the autoimmune spectrum. And so often I hear that, well, my lab work comes back normal, my lab work comes back normal, but I feel like crap.
Yeah.
And the doctors don't know what to do with it because my lab work's normal. So I'm going to just let you take that and wherever you want to take that.
Yes, that's what I was hearing a lot. I was hearing that a lot. They would say that. I said, I went to get checked out and everything came back normal. Yeah, I feel like crap. Like, what is going on? And I heard it so many times that I actually created that meme because so
Oh,
many people were
nice.
telling me the same thing. It was like a meme creator. So I was playing around with that. And I'm like, that's exactly what people say when they come to me. They're like, I don't know what is going on, but it is so true. There's underlying infections that we can find in our blood work. There can be things like food sensitivities, all kinds of things that's hidden in the blood work that it is not really predominant enough to pop up on a normal blood work, but it's still causing some issues beneath the surface and causing some of those health symptoms. Underlying viruses, low-grade viruses are actually the number one trigger for autoimmune diseases. So just beneath the surface, viruses can be there. And again, not really enough to cause major flare-ups, but enough where it's definitely affecting how a person feels, how their digestion is working, and just everything else. And it's there. We just have to really know how to look for it and make those corrections if we can. There's also can be micronutrient deficiencies, enough where, again, it's still going to be considered within normal limits, but if our vitamin D level, for example, was bumped up a little more, well, we would have more energy. We would feel less depressed and things like that. And that's one thing I do find a lot in my practice as a mental health nurse is that patients, when I look at their blood work, a lot of them have low vitamin D levels. And that range is pretty wide within the normal range. It's anywhere from 30 to 100, which is a huge range. So if you're, 30, does that mean you feel as well as someone who's like 85 or 90? No. 80 is the ideal range that we would like to see people's vitamin D at. So that's definitely one thing. If we just start looking at maybe if we increase the vitamin D level, maybe this will result in the person feeling better, having decreased depression, anxiety, all of those different things. So again, these are all steps that we can take now to ensure that our cells are supplied with all of the key nutrients that it needs, that it can work well. So that way it can fuel the rest of the body in order to have everything working together cohesively and as a well-oiled machine as best as it can.
Mhm. Yeah, the vitamin D thing, I at one point was doing blood work. I saw my vitamin D, and the doctor that did the blood work was like, "Oh, you're doing really good. Your D is at 39 or something like that." I was like, "Cool, I'm doing good." And then I had another person who looked at it from a functional standpoint look at it and say, "But your vitamin D is pretty low. Like, we need to boost that up." And I was like, "Oh, okay." And that's when it like stuff like that started to actually click for me. Is okay, so there's it's like with the vitamins and the recommended daily intake, right? That recommended daily intake is just to get you to the point where you can stay alive pretty well. Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode. It's
Mhm.
not like the optimum intake of your vitamins. So if you think about blood work like that, like you've got those normal ranges, which are enough to keep you from being in the hospital, but they're not necessarily the right range for you to be living optimally.
Correct. And to prevent
Yeah,
further illness and chronic conditions going forward. So true.
right.
And why aren't we really doing more of that? Yeah. So that really has definitely got me much more interested and really looking at blood work and really trying to teach people if you have these symptoms and your doctor keeps brushing you off, just know that there are other providers out there that can help you. Don't give up. Don't feel like you must be imagining things, or there's definitely look for a provider that is listening to your concerns, no matter what they are. Like even for basic things like sometimes I have a patient that will say, "Oh, I have this side effect from this medication." It might not be related to the medication or really a side effect that I've ever heard of, but it's real to the patient. And you have to acknowledge that, okay, this patient is experiencing this, and I need to acknowledge that, yes, this is what they're feeling, and then take steps to work with the patient. Same thing with the symptoms, feeling vague or I'm not sure. And people just need to know that there are definitely providers out there that know and listen and can help. So definitely reach out and look to see if there's someone that can help you with your unexplainable health symptoms. Might feel like crap and everything checks out normally.
Yeah, it's important to be our own best advocate. We have to not settle when it comes to our health. And it's so easy to settle when you're at least in the United States here, when you're trying to work within your insurance and the medical system. You may only have a certain number of options available to you. But there are so many options outside of that. Just looking at your Facebook page, there is so much information on all of your posts. People can find information other places, but you have to step up for yourself to do that. So I
Right.
do encourage anyone listening to step out of the box and be open to other alternatives, or just be open to asking for a second opinion from a different doctor within your medical system. So
Yeah.
great point there. When you're talking about, or when we're talking about blood work, if I go in to ask for blood work, say I haven't done it in a while and I want to go in and get a full range of blood work done to see where I'm at with levels. I know I have autoimmune. Maybe somebody else doesn't know, but I want to see where I am at with different things. I don't know exactly what to ask for other than the standard CBC tests. I can ask for a vitamin D test. What do you recommend to your clients when they're trying to investigate these symptoms that haven't been pointed yet?
Yeah. So the lab work that really, there's not complicated lab work. I do get a CBC with differential. I do ask for that. I also get a comprehensive metabolic panel. I like to do a full lipid panel. An iron panel is another one that I like to do. And I like to do the thyroid panel as well. And if people are looking for hormones, I'd like for people, again, if they're going to their primary care physician to ask for the blood work, do all of the hormones, not just testosterone, but really all of the hormones. And I also like to do the blood sugar component. So the fasting glucose and the hemoglobin A1C. And that alone can give you a lot of information. And these are just regular tests that primary care physicians shouldn't walk at or really give people a hard time with. There are more testing and things that we can do to ask for later on, but just that alone is going to provide a lot of information, and we'll be able to detect about 95% of the things that I see in the majority of people when I look at their blood work. So that's just regular labs, nothing really crazy. But yeah, it's important to make sure we ask for them because the differential with the CBC is important to look at. Without the differential, we can't get as much information, but everything else, that would be a good comprehensive overall panel to start with and look at.
And for people listening that aren't familiar with what a differential means, can you expand on that?
Yeah, so the complete blood work just gives you just a really generic list of all of the blood components. With the differential, it really delves a little bit deeper into all of the different white blood cells that are available. So you might just get white blood cell count and that's it. But we have 5 different types of white blood cells, and those are the ones that I like to look at. And those are the ones that would be included in the CBC with the differential.
Okay. And is that where you're looking to see potentially underlying virus
Yes.
loads?
Yes, I look at those 5 white blood cells because those 5 white blood cells will allow us to determine if there is an infection, if it's bacterial or viral. And it also allows me to look at if there's any food sensitivities, if one of the particular blood work markers is elevated, and if the client has eliminated everything from their diet and they're still having symptoms, then that's a big clue that there's a parasitic infection that's underlying. So when we look at those things, underlying bacterial infections, again, it's not going to be something that you need an antibiotic for, but it's definitely something that's going to cause some GI symptoms. It's going to cause the bloating, the constipation, the diarrhea, just the messed up guts. And the underlying bacterial infection can also present as joint pain. That can be an infection that we discover. And with the viral component, too, with the lymphocytes, that's the white blood cell that I look at to see if there's an underlying viral component. people may be experiencing things like chronic fatigue, low energy. They can't get out of bed. No matter how much sleep they get, they're still like dragging themselves through the day. And that can be an underlying viral infection. Not enough where, again, it's going to be flagged, but enough where it's triggering autoimmune diseases and it's triggering all of these symptoms that are happening as well. Another thing too with the virus is monocytes is another type of the white blood cell that I look at. And this also is a viral, component. And if this lab is high enough, then it can test positive for Epstein-Barr. So to have this be a positive test for Epstein-Barr, the range would have to be, say, for example, 11 to 12. But if the range is 8 or 9, it's still there. So it's still there, and it still could be causing us to just, again, can't get out of bed. I don't know why I'm so tired all the time. I take vitamins. I do all of these things, and I still feel like this. So those are the particular ones that I like to look at. And the vitamin D, just because I find so many times that can be a source of fatigue and depression. Iron is another one too, especially for women because of our menses. So if we have low iron stores, that can certainly be contributing to our chronic fatigue and just other symptoms. So again, those are all things that we can be looking at. And as a psychiatric nurse practitioner, right, those are the things that I should be looking for first. When patients come to me and I can't get out of bed, I'm really depressed, I'm always fighting with my husband, I'm irritable, so on and so forth. This is not the traditional first approach that nurse practitioners take. It's okay, we're going to do a screening. I'm going to talk to you about your symptoms. Yes, I'm going to take a health questionnaire and all of that, of course. But then it's okay, let's talk about an antidepressant. Let's talk about the next step. It's never, let's see if we can clear up some of these infections first before we can discuss medication. And that's why I wanted to take this alternative approach. So that way in my practice, I'm able to practice in this way and look at blood work and take this integrative approach. So I also have my own integrative psychiatry practice where I can do this first. I'm not tied to a regular position where my role is really as a prescriber. And that's the thing that I was finding, is that what I really wanted to do with patients, I was limited in my scope of practice working in the traditional Western medicine approach to medicine. So I find that this is much better. Not that it's not that Western medicine is bad, but it's just that we're not using all of the tools that are available to us in the toolbox. And why aren't we doing that? We can, even after all this, we may find you still need that antidepressant, but wouldn't it be nice to know that maybe some of this could clear up that fatigue or clear up some of that, depression? Of course, that would be great.
Yeah. And perhaps the dosage could be much lower because you cleared out some of the other stuff that was layered on top of the depression, right?
Yeah, absolutely.
Yeah, I think that's super important because I've come across questions where it's like, well, okay, I have lupus and I've got all these pain symptoms and my joints hurt, everything's inflamed. Therefore, I'm on all these medications to help combat that. But have we looked at diet? Have we looked at how you're hydrating? Have we looked at how you're sleeping? Can we normalize and address some of those things that might actually be triggering some of those symptoms? Maybe some of that joint pain is because you can't do gluten, but you just haven't realized it yet, or you can't do nightshades, or maybe it's because your cortisol is all screwed up because of your sleep schedule. Let's address some of these basic fundamentals so that we can, remove that layer off of your symptoms and then see where we're at and then address from there.
So true.
Yeah.
So true.
Yeah.
I think people are looking for that quick fix, that pill that's going to make everything great. And it really comes down to the basics. Make sure we eat clean food and we're having a good night's sleep and we are outside breathing in fresh air, and all of that's so important. Yet we really don't focus on it as much as we should, but it really makes a huge impact. I know if I don't get enough sleep, that's definitely going to affect my energy level the next day, my irritability with those around me. Certainly that has an impact and can have a greater impact over time. The less and less sleep we get, the not only our emotional health, but it takes a toll on our physical health too. And if
Yeah.
we're exhausted, that also, if we're tired, our pain levels, the thresholds are even lower. So we're more likely to feel more pain just by the fact that we're just dragging ourselves around through the day and we're just exhausted. So it all matters. It's like a piece of the puzzle, and we want to make sure that we have all the pieces and that all the pieces are working well and working well together. So that way we can be our best.
Can you talk about stress? Like stress, anxiety. I see with so many women in particular that are in the chronic health space or in the autoimmune community, there is a long history of stress, whether that's whatever source that comes from. We take these things on as emotional stress and we put all this weight on our shoulders, whether we're doing it intentionally or not. It's our experience, right? And
Mhm.
how can that sort of thing affect the body over time? And how do you or can you read that in blood work and in your intakes?
Yeah, so stress unfortunately does take a big toll on our not only our emotional health but our physical health. And you mentioned it before that when we are under stress, whether it's a perceived stress or an actual stressor, our bodies go into fight or flight mode. And when we're in that mode, our stress hormone secretes, which is cortisol. And the higher the amounts of cortisol that we secrete in the body, the higher the risk is that we develop type 2 diabetes. It can lead to weight gain. It can lead to high cholesterol, and it can put us at higher risk for cardiovascular disease. And that over time, our bodies are not designed to be under stress in just chronic stress, where we get to a point where the amygdala, which is the thermostat of the brain, over time, it can't perceive what's a real threat and what's a non real threat. And then it doesn't have the ability to regulate itself and say, okay, that's not really a lion that's chasing me. It's just I'm stuck in traffic. But the body doesn't really differentiate that. So unless we really figure out a way to do that, the longer that our body is in that stressful state, the more physical symptoms that we're going to be experiencing, and the higher the risk is that we're going to be developing those chronic illnesses. And those are really a lot of the illnesses that many people, unfortunately, there's a low mortality rate. And a lot of people have type 2 diabetes and high blood pressure and all of that. And that a lot of that can be related to stress because the body's just constantly secreting these stress hormones, and then it just is a vicious cycle. So it's so important that we take the time, just as much as we can, take 5 minutes to bring down the stress level, whether that's taking a couple of deep breaths, being quiet for 5 minutes, just really trying to recenter. Because just doing the deep breathing, for example, just for a few minutes will automatically bring down our heart rate, bring down our breathing, and let our bodies like come back down to normal and relax. But you know, so many of us don't really do that. We just go from one thing to another. So that is definitely something that stress has had a big impact on as well. Stress, I've also found too, is a big trigger of asthma attacks. And I was like, wow, really asthma attacks. And the more that I started looking at that, it's true. It is one of the triggers. It's just stress can induce that because, again, then the body doesn't know what's a real threat, what's not a real threat. And there goes all of the stress hormones and the increased respiratory rate. And it can lead to an asthma attack and all other kinds of things too. Stomach aches, headaches, back aches. Those are some of the other physical symptoms that I see people experience when they have chronic stress. So they've had brain MRIs done and CAT scans, and they continue with headaches. They don't know how to deal with them, or the stomach aches. I've had everything done and I have these stomach aches. That can very much be a somatic symptom from stress. Yeah.
Yeah, I can see just in my own personal history, stress coming out in stomach bloat, irritation, and a lot of pain up here when I'm stressed. That's where I tense
Yeah.
up and I curve up and I hold everything. So, yeah, stress is an interesting one. When it comes to cortisol and hormones such as cortisol, do you test for that when indicated? Are there specific tests people can ask for to find out where their cortisol levels are and if that's something that needs to be addressed?
Yeah, they can definitely ask their physicians for that. It's not something that I typically will ask, but just based on the patient's symptoms, and I give them like a medical questionnaire. And if they're telling me they have these headaches all the time and these stomach aches, to me, it automatically indicates that the body is under some sort of a stress. And I almost anticipate that their cortisol levels are elevated just because of the symptoms that they list that have, of course, been medically ruled out. Um,
Mhm.
but yeah, that's something that could be also asked for with blood.
Mhm. And then what about, we've talked about vitamin D, but what other nutrient deficiencies do you look for or can be affected by not only stress, but also maybe underlying viral infections, other things that you see in your practice that can be affecting things that we don't even realize, such as vitamin D or, you know,
Yeah,
magnesium, things like that,
yeah,
that can make a big difference if we, yeah.
absolutely. And vitamin B12, vitamin B is another one too that can definitely affect our mood. But one area, I guess, that really could be the problem as far as why we're deficient in vitamins and nutrients has to do with our gut health. So our gut plays a huge role in our health, our mood, and also our immunity. And when we have gut health, we're able to digest properly and we're able to absorb nutrients properly. So we might be taking all of these great supplements and all of these vitamins and eating the best food, but if there's an issue with the lining of the gut, for example, or if the gut is inflamed, it's the nutrients are not getting into the cells. So definitely a lot of the patients that I see that have mood disorders also have some sort of like a GI disorder, making sure that our microbiome is in balance. This is the good bacteria that is needed. It's crucial for immune function over health, overall health. And also our gut acts as a natural barrier for any pathogens or any toxins. And our gut is also responsible for producing vitamins and hormones. And when the lining of our gut becomes impermeable, it's also called leaky gut, then our gut is losing its main barrier and we're not able to absorb nutrients. And then we see all of these different um, things that can occur just because of our gut health.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
It also helps to regulate inflammation. Our guts help do that. And it helps in preventing chronic inflammation. And many times when there are patients say that they're depressed or they're anxious and they also have the gut issues, it's nice to look at their gut first, because the other great thing about our gut or our second brain is the fact that a lot of the majority of the serotonin, the mood, feel good neurotransmitters are in the gut. And if we have our gut is not as healthy as it should be, that's going to affect the production of the serotonin, which is going to affect our mood. So it just is this cycle that we could be feeling depressed just because our guts are full of toxins and they're inflamed and all of that. So that's definitely one thing that I see a lot is the GI symptoms that people have, that really it's not surprising because our diets, lack of exercise, we're not drinking enough water throughout the day, and it just can just again cause a whole array of health symptoms too. But the gut's definitely one that I see. The vitamin D, the vitamin B, those are the main ones that I definitely see. And also magnesium. You can look at every single vitamin and look, but those are the major ones that I find the most often that people have.
Well, it's pretty well established at this point, at least on the holistic side of things, that there's that really important gut brain connection. And they say that our gut is our second brain. It informs our brain. So if our gut dysbiosis is not, or if we are in dysbiosis, I should say, it can really affect your mood on top of your immune system, on top of your inflammation levels, on top of your just ability to manage everyday stress. So it's such an important aspect of health that I think is really just coming to the forefront now. And even on the Western side of things, I think they're starting to pick up on this.
Yes.
So, right. Yeah. So when somebody gets all their blood work done and you can see all these different areas, maybe underlying virus, maybe low vitamin D and whatever other things you find, how do you figure out with somebody where to start? Because there's so many different areas. Do you start with nutrition? Do you start with sleep patterns? Do you start with stress regulation? How do you start working with somebody to figure out a handleable approach for them?
Yeah, well, I take everything into consideration, and usually I try to address the issue that is the most that's having the most impact on the patient's life. If it's they don't go out on date nights anymore because they're afraid they're not going to find a bathroom and they have all of these stuff. So then we try to say, okay, let's tackle the infections first. So depending on what symptom is really presenting itself as the most challenging and having the most detrimental impact on the person, that's where we try to target it to. But over time, we want to make sure, okay, if we fix this, let's make sure you're also following a healthy diet. If we're going to really put you through a detox program where we're going to eliminate the infections and we're going to reset your microbiome, well, let's think about the types of foods and the nutrition that you want to have in order to ensure that you're going to maintain the good effects that come from doing a program like that. So we definitely talk about nutrition. I think that's very important, making sure that we're eliminating simple things in the beginning, because I don't like to overwhelm people with you need to do this and you need to have that, but just eliminate maybe processed food. Try to cook yourself if you can instead of getting like prepackaged stuff. Make sure that you're having a little bit more water throughout the day. Make sure that you have time to go outside for, even if it's 10 minutes, to go for a quick walk to get things moving. So we start off really slow and then we gradually titrate up, because many times the patients are so exhausted. They're isolating, their self-esteem is really shot. They've tried everything and they really feel like if I've got to do something that's really complicated and overwhelming, I'm pretty much not going to really have the time or the motivation in order to do that. So we start off really slow. But if I do find something in the blood work that needs to be addressed right away, if it's a viral component or a bacterial component or something like that, I will try to get them on a protocol where I provide them medical grade supplements, replenish the cells with nutrients, get working on their gut, and then start to talk later about, okay, once you start to feel like, okay, I'm getting a little bit of my energy back, I feel like my symptoms are less intense as before, then we can add kind of some of those other things. So that's usually how I like to approach it. But again, I work together with patients. And if patients say, hey, can we just tell me a good nutrition plan first or whatever, great. Whatever the patient wants to do, I take their lead and work together to achieve a level of health that's best for them and given the time that they have and all of that. So I offer a lot of options really to patients, but I do like to make sure that I stress that just because you do this 90-day program and you take all of these wonderful supplements and we get rid of the infections and all of that, you want to make sure that going forward, you're going to continue on this path to the health and make sure that you're making choices that are going to align with how you want to see your health evolve in the future and point them kind of in that direction. And I always focus sleep, make sure you get enough sleep, and always telling kids, I do a lot of work with children and adolescents, and a lot of them also say, trouble, I can't fall asleep, trouble staying asleep, all of this other stuff. And then I say, okay, how much screen time are you getting? Are you on your phone up until the moment you're trying to go to sleep? Well, yeah. Okay. Well, that's why you can't sleep, because your brain is so highly active. Like, you've got to put the screens away at least 2 hours within going to bed, take a warm bath, have a glass of milk, listen to relaxing music, read a boring book, just something like that. Because again, people are looking for what can I take to help me get to sleep? So let's try this first. We really want to make sure that you're doing everything that you can. And if it's still a problem with sleep, then we can talk about medication. But if you're just on the screen literally 5 seconds before you're supposed to turn the lights off, again, that's not really going to work. So yeah, that's
Yeah.
another one that comes up very often is the sleep. And then kids can't learn if they're going to school exhausted and they're up all night on their phones and a whole bunch of other things. So screen's a big one and sleep's a big one.
Agreed. Yeah, I work with that circadian rhythm reset and getting off the screens, paying very close attention to what type of lighting you have in your home. Or you have bright lights on overhead all night until you go to bed, or you have lower dim lights that are maybe closer to eye level or even floor level. Things like that make a huge difference in sleep quality and just the ability to have a full night's sleep versus waking up and stressing. And I know for myself, if I'm building this business, I still have another job. And when I push myself, oh, I got to get this and this done before tomorrow, and I stay on my phone or my computer doing research or whatever until late in the evening when I know I shouldn't be doing that, it gets me every time. And every morning I'm like, when I do that, so I keep to a minimum, but when I do that, I'm like, well, I had to learn that lesson again.
Yeah, that's true. Very easy
Yeah.
to say. Sometimes it's
Yeah.
unavoidable. And, you
Right.
know,
Yeah. So the consistency part of it, I think, not just with the sleep and the lighting and the screens, but with everything that we do, as long as we are consistent overall, we can bounce back from a night here or there of screen time or of eating foods that we shouldn't necessarily eat. we can bounce back. But it's that consistency,
Yes.
not perfection, but we're gaining that muscle of consistency. And that's what I think is so important when working with people like us.
Moderation. Yeah, moderation.
Mhm.
We can't be perfect all the time, but if we're consistent and we have here and there, we're not perfect, that's fine. Nobody's going to be perfect, and as long as there's some sort of a consistency, then that's good.
Yeah.
No, you
Well,
need.
Patricia, is there anything else that we haven't covered yet, or any last thoughts that you want to leave with our listeners?
Yes, so I'm hoping that this was helpful, and I'm hoping that people are curious about it. And yes, there's so many more things that I could go into and delve into the blood work. And just don't forget to be an advocate for yourself. Make sure that if something isn't quite right with your body, better than any physician or any healthcare provider, just follow your gut, because your gut is that second brain and it's always right. And just make sure that you are an advocate for yourself and just take charge. Yeah. And people the best on their health journeys.
Where can everyone find you if they want to look into doing blood work interpretation with you?
Yes, they can find me at wholehealthalternatives.com. So that's my website. And on the website, people, if they're interested in attending live workshops, I usually hold a live workshop once a month, and I teach the blood work. So I invite participants to come on with whatever labs they have, even if they don't have labs, if they just want to hop in and look at some of the markers and explain what each one of these things mean. I do that monthly. I just did one yesterday where I taught the five markers. Next month, I'll be doing one all on the thyroid, and there'll be future ones on the cholesterol panel. And usually every month, I like to tackle a different part of blood work and delve in. But if people want more information, then they can go to my website. And if they want to email me with any questions, or they want to know when the next workshop is available, they can definitely check out the website.
Awesome. That is super helpful. I love that you're doing those webinars. Just the more knowledge we can give people about their health and that people can soak in is just it's empowering in their health journey. So thank you
Yeah.
so much for joining us. Thank you for educating us, and thank you for being on.
Oh, thank you. Thank you so much. Appreciate it.
So I know that you learned a ton from that conversation, and it probably has you thinking of a whole lot of more questions that you have now around your blood work and around your health and around your treatment protocols. I hope that this gives you some really good information that you can use as a diving board for where you want to go next with learning about your health and learning about your situation. I find that when you're having a health experience, it can feel just so complicated to figure out really what's going on. And there's so many different opinions out there, and there's so many different treatment protocols and recommendations by all kinds of different health professionals. And it can be really overwhelming to know where to start. Starting with somebody like Patricia, who can really dive in deep to your blood work and see what is really going on in your body based on, you know, based on those labs is really, really beneficial because it helps you not just play guessing games. It helps you really dive into the underlying causes of things. And of course, that's can give us the springboard to look at, we can see what's causing maybe being affected in the blood work, but then we can use that information and take it further and go into lifestyle choices, stressors, all the different things that we talked about in the episode that can also impact your health for the better or worse. But starting with your labs is always a really important place to start. And I really encourage you to get a hold of Patricia and start there with another opinion. Definitely go with your GP or your rheumatologist, but also balance that out with extra information that Patricia can give you as well. So I really hope that this helps in your journey. If you are looking to really start to create changes in your life to help your symptoms minimize. We were talking earlier in the episode about how, sure, you've got joint pain. Joint pain comes along with your autoimmune condition, but are there other things in your life that are adding to that joint pain that may or may not have anything to do with your actual diagnosis? If you're ready to dive in deeper and look at those things and see how you can up level just your fundamentals of health to get yourself back on an even playing field, and then you can really see where your autoimmune symptoms are after that, I would love to have a chat with you. Message me. We'll set you up with a free health strategy call, and we can go over some of the things that might make a really big difference in your experience of health. I look forward to chatting with you, and I will see you here on the next episode of the Health Bridge podcast.